The St. Joseph Mercy Hospital, which is one of the longest-standing medical institutions in Guyana, is celebrating 75 years of providing services to the Guyanese population. Some 4 years ago, the executive board began streamlining systems to have its own medication accessible to patients at the hospital. In so doing, according to the chief pharmacist, Leandre Charles, the hospital partnered with a Canadian pharmaceutical company, which is responsible for producing the medication.
And we want to be assured that what we're selling is of the best quality. We decided to embark on a relationship with Carison Discoveries out of Canada. It's not often we get to interface with a reputable manufacturer. What usually happens, we have the manufacturer overseas, we have distributors locally, then we would buy from the local distributors, then sell to the customer. So you have 4 levels. In this arrangement, you're having 3 levels, us interfacing directly with the manufacturer, then to the consumer. So we're able to establish for ourselves, without any fear of doubt, that we are getting quality products.
The chief pharmacist assured that the medication has been tested and tried and currently meets the required standards.
That testing phase is probably just, the lab phase is probably just like a day or 2. So it's just to authenticate that the batch has meets the requisite standards. And so that is done for every batch. So we know that every time we buy, each batch is tested and each batch meets the standards. So sometimes you're not in a position to validate that if you buy from a distributor. So in this case, the manufacturer will supply us with that data for every batch that we order.
He added that because of the demand of the medication at the hospital, the supply of these drugs was important. He noted that these medications are still efficient in fighting a number of symptoms.
Panadol is the most widely used painkiller. It's also very effective against fever. And so it's also one of the painkillers that is widely used in maternity patients. As you would know, maternity patients cannot use most of the drugs, so Panadol is still one of the safest drugs to use in maternity patients to control fever pains. Aspirin again is pain, but it's also used with cardiac patients for blood clotting reasons. So these are the 2 most widely used drugs.
The bottled medications are sealed and contain 30 tablets, an average of which constitutes to 1 month supply. So far, the hospital has received multiple offers for the drugs to be sold in wholesale quantities. However, Charles revealed that a decision is still being made at the level of the board. The Catholic Hospital located on Parade Street, Georgetown, was first established in August 1945 by members of the Sword of the Spirit movement. The idea of having a Catholic hospital was attributed to Italian surgeon Dr. Cesare Romiti, who handed over the management of the hospital to Sisters of Mary. The institution is staffed with 10 primary doctors and 60 affiliate doctors. Tamika Rodney reporting for HGP Nightly News.